NIS 480 Exam 3 Newest 2026-2027 Actual Exam Preparation with complete questions and correct answers with rationales. Question 1. During a family conference, the nurse practitioner is leading a discussion with a family, which includes a 15-year-old adolescent who often forgets to check his morning blood glucose levels. Which questions would be the most appropriate for the nurse to ask? Why would a person neglect his body? Can I tell you about the dangers of high blood glucose levels? Do you think forgetting to check the blood glucose is a way of acting out? I understand that you are all concerned with Checky. D. Question 2. When planning interventions for a family with rheumatoid arthritis, it is essential that the nurse include which family member in the discussions regarding treatment options? The child with the illness, the father as the breadwinner, the mother as the primary caregiver, all family members who are available. D. Question 3. According to Neffel and colleagues' theory of normalization, families including a child with a chronic illness must perform which action to adopt a normalcy lens? Actively deny aspects of the illness that are unpleasant or burdensome. Focus attention equally on normal siblings and the child with the chronic illness. Recognize the ongoing processes of actively adapting to the child's evolving physical, emotional, and social needs and establishing new family routines. Advocate for the C. Question 4. The nurse notes that a family with a child newly diagnosed with a chronic illness has no experience with the disease. Therefore, required routines and family life are disorganized. Which need is this family experiencing? Re-education, redefinition, remediation, realignment. A. Question 5. The parents of a child with muscular dystrophy have a negative view of the child's future and feel hopeless about future care needs. Which view of the child is the family demonstrating? Thriving, enduring, floundering, accommodating. C. Question 6. The nurse prepares to assess a family with a member who has a chronic illness. On what should the nurse focus during this assessment? Select all that apply. A. Sibling needs, core processes, nutritional needs, economic restraints. E. Developmental milestones. A, B, D, E. Question 7. While providing care for a family, the nurse reviews the common reactions of siblings to a diabetes diagnosis. Which statement is true regarding siblings of individuals with diabetes? Select all that apply. Some siblings of children with a chronic illness feel pressure to be the good child. Most siblings of children with a chronic illness develop behavior problems. Most siblings of children with a chronic illness feel shame, related embarrassment about their sibling. Some siblings of A, C, D, E. Question 8. The nurse plans to use an empowerment model to plan care for a family who has a member with a chronic illness. Which type of care will the nurse use to support this family? Select all that apply. Problem-based, strength-based, evidence-based, patient-centered. E. Spiritually relevant. A, B, C, D.